Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers.
Hi, friend. Today we're talking about another question I get asked a lot. How long should you wait before clamping the umbilical cord? And if you've gone down the internet rabbit hole on this, you've probably seen a lot of different answers. So today I'm going to walk you through what the actual evidence says and the most up-to-date recommendations so that you can make a decision that feels right for you and your baby. But before I do, if you want the notes for this video, just drop cord clamping in the comments and I'll send them to you. One thing I hear all the time is, everyone says something different. Some people say wait 30 seconds, others say a few minutes. And then you'll hear things like, wait till the cord stops pulsing, or even longer. You might even come across things like lotus birth, where the cord isn't clamped at all. And at some point, it can start to feel like, if I don't do this the right way, am I missing something important for my baby? And that's where it can start to feel overwhelming. And it's not because you're doing anything wrong, it's because you're trying to make a really thoughtful decision using information that isn't always presented clearly. So here's the real problem. One of the biggest gaps in birth education is that we hear recommendations, but we're not always told what those recommendations actually represent. Because there's a difference between the evidence itself, the recommendations that come from that evidence, opinions or interpretations, and what may be true in real life, even if it hasn't been fully studied yet. And once you understand that, it starts to make a lot more sense why you're hearing so many different things. For example, we know there are clear benefits to delayed cord clamping for at least 60 seconds. Beyond that, we don't have strong evidence showing additional benefit. So it's not that longer delays are proven harmful, it's that we don't have enough evidence to recommend them routinely. And what we know is that the majority of the benefit happens early, and then that benefit starts to plateau over time, while we may see a slight increase in risks like jaundice. So at that point, it becomes more of a balance than a continued advantage. So instead of trying to figure out the perfect amount of time, it's more helpful to understand where the benefit is clear, and then look at how that's actually applied in real clinical recommendations. So let's look at what those recommendations actually are. If you're looking for a clear, evidence-based starting point, the most updated guidance as of 2025 from organizations like the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics recommend delaying cord clamping for at least 60 seconds in healthy newborns who don't need resuscitation. Now, you may also hear people say 1 to 3 minutes. And that comes more from physiologic understanding and global guidance from the World Health Organization in 2017, because most of the blood transfer from the placenta to the baby happens within those first few minutes. So by around 2 to 3 minutes, the majority of that process is already complete. But the actual recommendation we rely on clinically is at least 60 seconds, because that's where the benefit is clear and well supported by research. So instead of chasing the perfect number, it's more helpful to understand where the benefit clearly happens. So what are the benefits we actually know based on the available research? When we delay cord clamping for at least 60 seconds, there are a few benefits that are really well supported by research. First, babies receive higher blood volume from the placenta, and that matters because it helps support their transition to life outside the womb, especially as they start breathing and circulating their own blood. We also see improved iron stores, which is a big benefit for term babies. These increased stores can last for several months after birth, and that's important because iron supports brain development and helps reduce the risk of iron deficiency anemia in infancy. And we see stronger outcomes for preterm babies. This is where the benefits are huge. We see a lower chance of needing blood transfusions, a lower risk of bleeding in the brain called intraventricular hemorrhage, and a lower risk of a serious intestinal condition called necrotizing enterocolitis. And newer research even shows a reduction in death before hospital discharge when cord clamping is delayed. So to put it all together, when we talk about delayed cord clamping, we are not talking about a trend. We're talking about something that supports a baby's transition into life outside of the womb and has real, measurable benefits, especially in those first moments after birth. And that's why you'll see it recommended across major organizations, because the benefit in that early window is clear. So to recap, the biggest benefit of delayed cord clamping happens in those first moments after birth. That's when the majority of the placental transfusion occurs, when extra blood from the placenta moves into the baby. After that, there is little evidence to support continued increased benefits, but we do start to see something we pay attention to clinically, a slightly higher chance of jaundice. And jaundice is when a baby's skin or eyes start to look yellow. It happens because of increased bilirubin in the body, which is released when red blood cells break down. So when babies receive a larger volume of blood, they also have more red blood cells. And as those cells naturally break down, bilirubin levels can rise. And because a newborn's liver is still developing, it's not as efficient at processing that bilirubin, so it has to be cleared through the body, primarily through the stool. And sometimes, especially when levels rise too quickly, the body needs a little extra support to keep up, which is why some babies need treatments like phototherapy to help bring those levels down. Most of the time, jaundice is mild and easily treated, but if bilirubin levels get too high and aren't treated, it can have negative effects on the baby's brain. So it's something we monitor closely in newborns, not because it's always dangerous, but because we want to prevent it from becoming a problem. Now, I understand that it would be preferable to be able to give a clear answer here of exactly how long is best. The reason you'll hear that 1 to 3 minute range is because that's where the majority of the placental transfusion happens. And beyond that, we don't see a strong increase in benefit. That doesn't mean longer is necessarily harmful. It just means we don't have strong evidence that it adds more benefit. So instead of saying longer is always better, we look at it as there's a window where we know it helps. And after that, it becomes more of a balance of risks and benefits than a clear advantage. In real life, what this often looks like is baby is born, placed on mom's chest, there's a natural pause. That first minute or two of delayed cord clamping is happening while you're meeting your baby is transitioning, and that blood transfer is occurring from the placenta to the baby. And then the cord is clamped in a way that supports both the baby's benefit and safe clinical care. So how can you actually approach this? Step 1, know the baseline. First, know that delayed cord clamping is standard in most settings now, typically for at least 60 seconds when the baby is stable and doesn't require resuscitation. Step 2, start the conversation early. If this matters to you, ask your provider, what is your typical practice for cord clamping? Step 3, communicate and collaborate. If you have a preference, communicate it clearly and have a conversation about how that fits into your specific situation and how it might realistically play out in your birth setting. Step 4, understand the exceptions, and also understand that in some situations, immediate clamping may be necessary for safety. And that doesn't mean something went wrong. It means your team is responding to what's needed in that moment. And when you understand that ahead of time, you can walk into birth feeling informed instead of caught off guard. A couple of side notes that often come up with this. Cord blood banking. If you're planning on banking cord blood, that can sometimes change how long the cord is left unclamped, because you need to have enough blood left in the cord to meet the minimum amount for storage. And that's something that you'll need to discuss with your provider and the cord blood banking company ahead of time. You might also hear about something called cord milking, which is different from delayed cord clamping. With delayed cord clamping, you are waiting to let the blood transfer naturally from the placenta to the baby. With cord milking, the provider is actively pushing that blood toward the baby to speed up the process. So it's basically a faster, more active way of getting that extra blood from the placenta to the baby. And it's sometimes used if a baby needs immediate support after birth. But for very preterm babies, especially under about 28 weeks, studies have shown an increased risk of bleeding in the brain with cord milking. So in that group, the risk outweighs the benefits. So let's bring this all together. Delayed cord clamping has real benefits. It's recommended for at least 60 seconds. The biggest benefits happen early. We don't see strong evidence of additional benefit with slightly longer delays. And like so many things in birth, it's not about doing more. It's about understanding what actually makes a difference and then deciding what's best for you. So when you think about this decision, the key isn't to ask, how long can I wait? The real questions are, what benefit am I hoping for? What does the evidence support? And what aligns with my values? Because that's what allows you to stay grounded, even if things don't go exactly as planned. I hope this was helpful and you feel a little more clear and a little less overwhelmed, because there's a lot of information out there. And when you don't have the full context, it can start to feel confusing really quickly. But when you understand what actually matters and how to think through the information you're hearing, you can walk into your birth feeling a lot more grounded and confident in your decisions. If you want my notes from this so you don't have to remember all of it, drop cord clamping in the comments and I'll send them to you. And I'd love to hear from you. What feels most important to you when it comes to cord clamping after hearing this? Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.